Hello, everyone. My name is Dimitri Trejo, and I am the Communications Manager for the UTRGV School of Medicine and Division of Health. And today we have with us Dr. Jose Campo Maldonado, and he is the Director of Infection Surveillance. And a lot of times in regards to COVID-19, the public either on social media or word of mouth has been hearing just some sort of, myths. And I think this also creates panic. So we want to just kind of cover some of these topics that we've been hearing, and you can let us know if is this a myth, or does this hold some truth, and should this be a concern? So the next question is: exposing yourself to the sun or to temperatures higher than 25 Celsius degrees prevents the coronavirus disease?
I don't think we have evidence to support that right now.
Mm-hmm.
There are some hypotheses I read about, and it will be good to follow on those. If the number of people that can be infected, that's what we call the reproductive number, is just how many people could get infected from one person who is infected, right? Mm-hmm. So that number, there are some hypotheses that maybe could be different between warmer and cold, but the virus can be transmitted anyway, whether in the cold or in the warm. And there are risks about trying to expose yourself to very high temperatures or very low temperatures. So the virus, once gets into your body, it doesn't matter. Your body regulates the temperature very well. Once it's in your body, causing an infection, you cannot kill it with heat or cold, because your body's temperature is well regulated.
Okay, thank you. The next question is, or statement is: being able to hold your breath for 10 seconds or more without coughing or feeling discomfort means you are free from COVID-19 or any other lung disease. Is this true, or is this a myth?
No, that's not true. And I think you can go back to the earlier questions that we were talking about, right? We know that there are people who cannot have symptoms or very mild symptoms. So if they can do that, doesn't mean that they cannot transmit the disease or get the disease. If they have it already, they have it, right? So I don't think that's an accurate statement.
Thank you. The next question is: catching the new coronavirus means you will have it for life. Is that a myth, or is this true?
No, that's a myth. We have the documentation of people. In fact, some of the protocols to release people, for example, healthcare providers back to work, there are two ways to do it. One is clinically, people got better and the time passed. And the other one, if you have the resources, is to do it with a lab test, which is repeating the test for the virus. So we know that initially you can detect it, and then on a follow-up test, then you end up not detecting it. So it seems to be that, like other infections like this, that once your body takes care of it, and I said your body because there is no specific treatment, it's your body which has to take care of it, right? And then the infection goes away. But it's an interesting question, because we know that for some viruses, like the herpes viruses, they can survive. I don't know if you have heard about the chickenpox, but you get it, but then when you get older, your immune system may become weak. If you haven't got the vaccine, then you can get shingles, right? So that it survives in your nervous system. But we don't have evidence that this virus does that.
Thank you. The last question is: drinking warm water can help flush down the coronavirus into your stomach. Is this a myth, or does it hold some truth?
That's a myth. Because the virus interacts with cells and receptors on cells. So if it's done all that already and is attached or went through, I think that shouldn't work at all. I think I don't think anybody is concerned about this being a meaningful intervention, even to study it, because I don't think it will be likely that will help. Yeah.
Okay, well, thank you. So that was our Mythbusters or Truth section, and this completes the interview. We want to thank you for your time, Dr. Jose Campo Maldonado, for sitting down with us and explaining to us what's going on in regards to COVID-19 and how we can protect ourselves. Thank you.
It's a pleasure. Thank you, Dimitra.